Hello everyone. So we have a case today. So he is a 30-year-old male who presented to OPD with multiple mobile swellings on his limbs and torso, predominantly on upper limb. So upon examination, the skin or the swelling was found to be normal. The swelling was soft to firm in consistency with a normal appearance and a slippery nature when attempting to grasp the swelling. Some swelling exhibited fluctuation and those near the elbow were slightly fixed and mildly tender. Transillumination test results were negative. Okay, then we have these images. So this is the first image of right upper limb. It shows, both the images shows multiple swelling of the right upper limb, and then we have this image of left upper limb, again showing multiple swellings. Fine. So then we have this question: complete diagnosis. Why swelling near the elbow are slightly fixed? What are the complications of this swelling and what are the treatment options? So before discussing this case, so let us discuss what is lipoma. Okay, so this lipoma is basically a superficial subcutaneous tumor. Okay, so this is benign tumor and it is most common type of benign tumor of soft tissues. It is composed of mature fat cells. Okay, so it is composed of mature fat cells which are enclosed with thin fibrous capsule. So enclosed with thin fibrous capsule. Fine. So it is also known as universal tumor. Universal tumor. Okay, it is also known as ubiquitous tumor because of this lipoma. It is seen in every area of the body, so it can be seen anywhere in the body. That is why it is known as universal tumor. Okay, so most common sites we have nape of neck, trunk and upper extremities. Fine, so these are the most common sites of lipoma. Now let us discuss what are the different types of lipoma. So first we have encapsulated one. Encapsulated, it is that type of lipoma in which there is capsule. Okay, so capsule is there. Then second is diffuse type of, in which there is pseudo capsule. There is no exact capsule. Fine. Then we have multiple lipomas. Multiple lipoma. So multiple lipoma mein it is also known as lipomatosis. Fine. So we are going to discuss three main important type of lipomatosis. So first we have multiple symmetric lipomatosis. Fine. So this multiple symmetric lipomatosis is also known as benign symmetric lipomatosis. Okay, it is also known as maid lung disease. Maid lung disease, and it is also known as Benign disease. Okay. So this thing is rare with unknown etiology, and we have multiple unencapsulated fat deposits. Okay, it is associated with increased alcohol intake and mitochondrial deficiency. Okay, mitochondrial deficiency. The exact mechanism is not known. Okay, so mostly it is seen in 30 to 60-year-old patients, and mainly they are males. Okay, so males, and site is neck, shoulder and upper limb proximal part, then thighs and abdomen. So less commonly seen on thighs and abdomen, and mostly seen on neck, shoulder and proximal upper limbs. Okay, and then it is associated with CLD, okay, chronic liver disease, metabolic syndrome, dyslipidemia, hypertension, diabetes mellitus and peripheral neuropathy. So it is associated with these diseases. Okay, so besides, after this multiple symmetric lipomatosis, we have one more thing which is known as familial multiple lipomatosis. So this familial lipomatosis, multiple lipomatosis, is one differential diagnosis of multiple symmetric lipomatosis, and the second differential diagnosis is Derkam disease. Okay, so let us discuss this familial multiple lipomatosis. Okay, this is rare, it is rarely seen, it is autosomal dominant, there are multiple lipomas, and sites usually is arm, trunk and neck, and it is seen in young adults and adolescents. Okay, so it is seen in young adults and adolescents. This is multiple familial lipomatosis. Then third is Derkam disease. So this Derkam disease is also known as adiposis. So this is known as adiposis dolorosa or lipomatosis dolorosa or adipose tissue rheumatism. Okay, so this is Derkam disease. Again, it is rarely seen, etiology is unknown, there are multiple painful, so there are multiple painful subcutaneous lipoma or angiolipoma. Okay, lipoma or angiolipoma. Fine. So it is usually seen in females, mainly in obese females. Okay, and sites we have extremities, trunk, pelvic area. Okay, so these are the sites where this Derkam disease is seen. Okay, then they say it is associated with mood disorder, chronic fatigue syndrome, chronic pain and fibromyalgia. Okay, so fibromyalgia, so these are basically the types of lipoma. Okay, so then we have, after this, complications of lipoma. Okay, so let us discuss complications of lipoma. So we have, first thing is saponification, then second thing is myxoid degeneration, third thing is calcification, and fourth thing is malignant transformation. And this malignant transformation, so we have sarcomatous change. So it develops liposarcoma. So these all are basically complications of lipoma. Fine. Complications of lipoma. And then besides, we have these clinical features. So in clinical features, we have swellings. So if we are talking about subcutaneous lipoma, so we have swellings in subcutaneous area. Okay, so they may be 1 to more than 10 centimeter in size. So they can be round, they can be oval. Okay, they can be round, they can be oval, or they can be lobulated also. Fine. And these lobulation, they appear on firm pressure over the swelling. Fine. Then second thing is slip sign. Slip sign. When you try to catch hold these swelling, it slips. Okay. So this is slip sign, and this is characteristic feature of lipoma. Fine. Then we have consistency. It is soft, it is not cystic, it is soft. Okay, so this differentiated from cystic swellings. Then we have transillumination, and transillumination is absent mainly. It is absent mainly. Okay, then we have fluctuation. Fluctuation is basically absent here, but they say pseudo fluctuation. Okay, so pseudo fluctuation can be seen. So pseudo fluctuation can be seen. One more thing, they are freely mobile over underlying structures. Fine. So they are freely mobile over underlying structures, except the swelling which are intramuscular, or with intra-articular extension. They can be fixed or slightly fixed. Okay, they are not that mobile. Fine. So then we have lipomas based upon the anatomical location. Okay, so lipoma based upon different type of lipoma based upon anatomical location. Fine. So first lipoma we have subcutaneous lipoma that we have discussed. So subcutaneous lipoma that we have discussed. Then we have subfacial, so beneath the fascia, subfacial. Then we have intramuscular, within the muscular layer. Then we have subserous, so this can be subpleural or peritoneal. Okay, then we have submucous. So submucous, they can be seen in GIT, they can be seen in intestine, and they can be seen in respiratory tract also. Fine. So respiratory tract. So in GIT, they are responsible for important thing, that is intussusception. So intussusception. And in respiratory, they are responsible for obstruction, which leads to dyspnea. Okay, obstruction. Then besides we have subsynovial, so beneath the synovial membrane. Okay. Then we have periosteals. Then we have intra-articular. Okay, intra-articular. Then we have extradural. So although we know that this intracranial lipoma are very rare, but there are some reports of intracranial lipoma also. So but extradural, here we are talking about spinal thing. Okay, so we are talking about spinal. Okay, so we have these lipomas. Then besides we have intraglandular, so they can be seen in breast, they can be seen in salivary gland, and they can be seen in pancreas. Okay, so these are intraglandular lipomas. Fine. So these all are lipoma based upon anatomical location. Okay, fine. So now let us discuss these cases. So this is a case of lipoma on the shoulder. Okay, and this lipoma had intra-articular extension. Fine. Intra-articular extension. So then we have second case. So this is a case of lipoma or the nape of neck and extending toward the shoulder. So this was also a lipoma. Fine. Then this is one more case. So she had a swelling for very long period, and then there was a rapid increase in the size of the swelling with change of consistency from firm to hard, and this was a case of liposarcoma. So whenever you find there is increased pain and there is rapid development, rapid increase in the size of the swelling, and there is change in consistency of swelling, so you suspect liposarcoma. Okay, so this is malignant transformation. Fine. Then we have this is again very rare. So this is lipoma of the hand. So this can be confused with ganglion cyst. Okay, so but this is lipoma of the hand. Then this is intraoperative image showing lipoma here. So this is intraoperative image. Okay. So this was basically intramuscular lipoma. Okay. Then this is the second. So again, this is post-op image of lipoma of back. So this is specimen, and this is incision. Fine. Then this is histopath examination showing adipocyte, mature adipocyte, and pushed nuclei to the side periphery. So this is nuclei. So pushed nuclei to periphery. So these are mature adipocytes. So this suggests lipoma. So now what is the treatment of the lipoma? Fine. So first thing in treatment we have excision. Fine, excision. They say lipectomy. Lipectomy. So excision. So when you remove it along with the capsule, this is known as excision of lipoma. Fine. Then second thing is enucleation. So when capsule is kept there, this is enucleation. Third thing is liposuction. So liposuction. So you can combine this liposuction along with this excision also. So combined approach can be used. Third thing is liposuction. And fourth thing, which is in reports in some studies, so that is injection deoxycholate. So injection deoxycholate in low concentration. Okay, in low concentration. So that is used. So this is treatment for the lipoma. Then what are the complications after surgery? So after excision, so if it is very large, there will be cavity formation, and there will be formation of seroma, or there will be formation of hematoma. Fine. So this was all about lipoma. Now coming to that case, so see, we have many swellings here in the right upper limb. Fine. These are many swellings, and they said there was pain in the swelling, and it was slightly fixed, which was over the elbow, this swelling. Okay. Then we have these swellings. Fine. So these all. Okay. Then again, this in this image you can see these swellings. Then complete diagnosis. So it is lipomatosis. Lipomatosis. Fine. These swellings were painful. Some of the swelling was painful. So you can say this is Dercum disease. Okay. Or it is lipomatosis. You can say lipomatosis. Then why swelling near the elbow slightly fixed? Because of intramuscular location, or because of intra-articular extension. Okay, these were the complications. So we have discussed complication. So there is saponification, there is calcification, there is myxoid degeneration, or there can be sarcomatous change, that is malignant transformation into liposarcoma. So what are the treatment options? We have discussed those treatment options like excision, enucleation, then liposuction, and then injection deoxycholate. Fine. So this is very important. So besides one thing I want to discuss here, we have neurolipoma, so which contain nerve tissue. So these are also slightly painful. We have fibrolipoma. Fine. We have fibrolipoma, which contain fibrous tissue, and then we have nevolipoma, so which contain vascularity with telangiectasia. Okay, so this is nevolipoma. Beside one more thing which was differential here, so that is angiolipoma. So this angiolipoma I'm going to discuss now. Angiolipoma. Okay, so this angiolipoma is basically seen in adolescents or young adults. Okay, young adults it is soft subcutaneous nodule. So you'll find soft subcutaneous nodules of size 0.5 to 2 centimeter. So they can be seen in forearm, they can be seen in chest wall. So they can be seen in chest wall, and they are multiple. Okay, they are multiple. And besides, so there are reports of angiolipoma seen in HIV patient after ART treatment. Okay, one thing. So they are painful, then they are tender. Fine, they are painful, they are tender. Besides, on histopathological examination, you will find encapsulated things. So they are encapsulated, and they have, of course, they have mature adipocyte, as it is seen in lipoma. So mature adipocytes, and there will be capillaries also, capillary vessels, and then there will be fibrin thrombi. Okay, so this is angiolipoma. Fine.